Finally, I'm successful. So, good to start?
Yes, good to start.
Yeah. Hello everyone, I'm Kalpana Chowdhary, founder of Social Tables, Managing Trustee and Chairperson of Jan Seva Foundation Being the Change and Lagna.com. Lagna.com is a matrimony portal for differently abled cancer and acid attack survivors. Along with it, I'm also a co-chairperson of ASSOCHAM State Entrepreneur Development Council, JSDC, member at FICCI CII, IWN Maharashtra, Women Economic Forum and a TEDx speaker. Before diving into the guest introduction, I would like to take a moment to introduce you with Social Tables. Social Tables is committed to sustainable development program with societal well-being and environmental consciousness. Every week, we bring out to you some of the brightest minds from the diverse sectors to discuss our ongoing few significant issues. In this week's speaker series, we have our honorable guest, Commander Navneet Bali ji. Commander Navneet Bali is the director of Narayan Health in the northern region. He has completed his master's in finance from NIFM and B.Sc from JNU. He has also done his financial administrative management course for the Navy and a special course on strategic financial management, inventory control and working capital management from Edinburgh Business School, Scotland. Prior to joining NH, he was associated with IOSPL Cancer Therapy Center as Group COO and Head Business. He also worked with Rockland Hospital as Unit Director. Before venturing into the healthcare industry, he served the Indian Navy for almost 30 years. In his current role at NH, he is responsible for overall strategic planning, operation management service excellence and business development of Northern region. His most recent appointment also include being the co-chairman National Health Council at ASSOCHAM, member Health Subcommittee ICAI, mentor for Atal Innovation Mission Niti Ayog, member Delhi NCR chapter and national conveyor media AHPI and the board member of MedML. A very warm welcome to you on our today's speaker series, sir.
Thank you very much. It's an honor to be here with you, Kalpana. I've heard so much about you.
Yeah, it's our utmost pleasure to have you here with us today. So on today's discussion, we are going to discuss about digital healthcare, a pathway post-COVID-19. So how is your experience of involvement in digital healthcare technology?
Kalpana, 2 दिन पहले मैंने when Apple was launching its Apple Watch 6, all of you who saw it, Tim Cook came on this, their Apple headquarters, and he was talking about Apple Watch 6, and thereafter they went to talk about iPad, the new ones. 80% of their talk revolved around, monitoring of oxygen levels in your blood. It talked about heart rate. So, imagine from where when the Apple first launched its watch to telling time, to telling, etc., etc. We have now progressed about everyone talking about health, and that also digital health, Yes. Every day you find new innovations coming up, people talking about it. So there is no doubt in my mind that, the future of healthcare will be digital, and digital healthcare will remain one of the focus areas of innovators, of thinkers, of healthcare players now as they move into the next many years.
Oh wow! I'm glad, sir. The experience for you was great because there's so much that you learned and taught over the years. So well, sir, what problems did you face before the outbreak of Corona pandemic in the use of technology in healthcare?
See, Kalpana, one thing was very clear that healthcare, especially I'm talking about public sector spending in healthcare in India over a period of time, because of the way our country has progressed, has not been great. And so technology spending in healthcare has been of a very small and bigger amount. At the same time, private healthcare, if you see, many cutting-edge technologies have been brought into India by private healthcare, like linear accelerators to treat cancer tumors. You have the best of the technologies. Robotics in doing surgeries has been brought to India. The top of the line procedures today, we have neural navigation systems into healthcare. So if I say that the best of technology is being now brought slowly into India. Just before COVID broke out, I think nobody ever imagined that we will be going through this phase of 5-6 months, and people are doing their jobs as normal. It was nothing. We never ever thought of that how life will suddenly change one fine day. Whatever one fine month, and we were sitting at our homes doing things in a particular way, and now what we are doing is a completely different ball game altogether. It's the new normal. Everyone talks about it. बच्चे को आप बोलो कहते हैं new normal है. So things have completely changed. But yes, just before that, people are not so much worried about what healthcare is all about. We were going about our jobs the way it was. But COVID has certainly changed the way we think.
Absolutely, COVID have indeed changed the mindset of every individual, even बच्चों को जैसे आपने बताया. They are also very particular. चलो immunity बढ़ानी, हल्दी का पानी पी लेते, दूध पी लेते. So well, sir, do you think that the healthcare can be completely taken over digitally, or is there some field which cannot be taken over by technology and has to be done with traditional methods?
See, I will take it in two parts, Kalpana. Healthcare has two very distinct parts. One is where there's an emotional and a humane part, and the other is a technological driven part. The humane part is when a patient who is sick, you would have heard that a good doctor with a smile on his face, when you sit in front of him, the way he talks, half the disease gets over. I mean, it is a saying, but that part of healthcare can never ever be taken over by technology. That means that come what may, whatever the advancements are, there are some part of healthcare in which presence of doctors sitting in front of the patient, okay, touching the patient, okay. Sometimes you talk about, many times you don't have to touch the patient, but sometimes just sitting in front of the doctor, and in our good times now, of course, touch is so prohibited. People have put plastic sheets in front, and people talk about it. But I think the parts where an initial consultation, पहली बार आप डॉक्टर के पास जाते हो, that part, sometimes when you have to actually the doctor has to sit in front with his voice, and you look into his eyes and he has to explain to you. Those things will never ever change. What will change certainly is let us say you need a second or third consultation. You are let us say aapki sugar level zyada high hai, you are a diabetic. Every time you don't have to go to the doctor. You can sit at your home, you are wearing a wearable watch or something, a device which tells the blood sugar levels. You send that to your doctor and you ask the doctor on a video call, doctor, can I do something, insulin badhana hai, kam karna hai. So that will certainly change. It is quite possible that with the advancement of technology, abhi aap 5G ki baat kar rahe hain, 6G, 7G, and the connectivity becomes better. Today, a doctor sitting in US will be able to operate a patient in Delhi, or a patient in Kashmir, or a patient in Kerala. So those are possibilities. But that humane part of healthcare, that part where you need a personal touch of a doctor many times, will never ever change.
Absolutely, and personal touch has to be there, because that heals you to I mean, today you see, even I'm fighting the cancer for the third time, but then when my doctor told me, don't worry, we are here, इतना ही बोल दिया बहुत है. Well,
exactly.
So what change did you notice in the use of digital healthcare during the outbreak of coronavirus pandemic? What were the counter effects?
Yeah, so Kalpana, what we found that initially when this pandemic broke in and lockdown started, I remember it was March ending somewhere there when we started having this. The first time Prime Minister announced that lockdown, and the first Janta lockdown, and then thereafter, of course, it was an institutional lockdown. So the hospitals became empty. The occupancy dropped drastically. People stopped coming, and it was not because diseases suddenly stopped. It was because people were confined to their homes, number one. Second is a fear came into people कि अगर आप hospital जाओगे तो आपको corona हो जाएगा. So hospitals were thought as places where infections are more, and obviously lockdown की वजह से people could not go here and there. But slowly, and so healthcare had to innovate itself. You could not get the patient to the doctor, but doctor had to go to the patient, and the only way possible was this video calls and video consultations. So the first change what we saw immediately was when patients started talking to doctors on the video. It was not a very ideal situation sometimes, but then there was no other way, and somehow doctor was able to get across. That was point number one. The second thing which happened was that, let us say somebody came to the hospital, got an X-ray done. The patient didn't have to go back to the hospital to get the report. All reports started coming on emails. They started coming on WhatsApps. They started coming digitally to you. That was the second change. The third change which happened was that, again, patients didn't have to go to the hospital to give their samples. Agar aapko blood test karwana hai, so people, the phlebotomists or they started going to home to collect the samples, so you didn't have to go. So somehow the healthcare adapted, and technology played a big part, because the monitoring of vitals, also with this digital wearables like Apple Watch, like many other things that you wear on your wrist, etc., which give you many parameters. There are many other things that you can have which can give you many other parameters, and they can be sent directly to the doctor's mobile so that also was used. So somehow doctors and the healthcare found a way to get across to patient despite the physical distance or the physical sort of obstruction in their movement, but healthcare could go to the patient. That was a very, very big thing to happen.
Absolutely, it was such I would rather put it was a revolutionary change, and as they say, with every adversity there comes a new opportunity. So हम लोगों ने वो adopt कर लिया है, and it have made even life much easier. Well, so because of all the changes that one had to face during the pandemic, people have adopted certain changes in the field of healthcare, like intaking immunity-rich food and adopting traditional way to fight coronavirus. Do you think they will accept the digital healthcare post-COVID?
See, I can tell you one thing for sure, Kalpana, that our traditional Ayurvedic treatments or, Unani or things like that, which are, ingrained in our own society, they have their own great benefits. There is no doubt in it. Today, turmeric milk is sold in the US at exorbitant cost. The golden milk it is called. So, and there is no doubt in my mind that to increase immunity, to make yourself more healthier, I mean, these all things that, Indian traditional or Ayurveda or traditional medicines, they have great value. But, but again, I want to come to the second part of the spectrum. If you believe that COVID, once you have a COVID infection, traditional means are going to, sort of help you, I'm sorry to say that there is no such scientific evidence, and let people not be, getting into that thing that, once they are infected with COVID, let us say their oxygen levels are falling, if they drink a kada or they, drink, it's going to cure them. It's not going to happen. So, there is a role of traditional medicine. And as I said, it is great to increase your immunity. It helps you to lead a healthy life. And then there's a role of allopathy. There's a role of other medical systems. So you have to know that not always traditional system will help, and not always, the European or the allopathic system will help. And also, there are many ways in which digital health is going to help you. As I said, elderly person cannot go to the hospital, So there is no which way other than all of us adopting the digital technology, despite the fact that we might be taking Ayurveda treatment, we might be trying to increase our immunity by using Ayurvedic treatments, but there is no harm in, using technology. You tell me today, even the elderly who never ever used to even look at the mobile phone, it's a technology, isn't it? Today they are on a WhatsApp, they have Instagram, they have so many channels, and they've always found that to be much more useful. They can contact their son or daughter sitting in US, Cambodia, anywhere, on a WhatsApp call. If any one of us who followed the traditional means of communication said that, no, I'm not going to adapt technology, would they even talk to their son sitting in US from India? They could not. So in many ways, technology is a great, great helper. If used sensibly, technology can be a game changer.
Okay. And do you also think that the shift of digital healthcare can harm us in any way?
See, technology, if not used properly, can harm us. There is that also has to be very, very clear. And to give an example, you have every day, research being done and articles coming that the use of social media, the use of, mobile phones, the use of technology, when it sort of surpasses or, goes beyond the personal human touch that we have, is very harmful. You can have 1,000 or 10,000 or 1 million friends on Facebook, but till the time you have one good friend who talks to you, who meets you, who has a cup of tea with you, then you don't have many friends. So technology has its uses. Technology also has its flaws. And the intelligent way of dealing with it is that that technology can be harmful if used in an excessive manner, if not used in a proper manner. Technology is here to help you, not to overcome your human judgments, to overcome the way you lead your life. So as far as healthcare is concerned, again, if technology is not used in a proper way, let us say, you are suffering from a disease in which you have to go to the hospital physically. You can't sit at home and say that technology is going to save me just when I talk. No, you'll have to go there to the hospital. You will have to, maybe a surgery has to be done. Maybe a biopsy has to be done. Aap ghar mein baith ke to you won't have a surgery done, isn't it? So technology can help you, but please, we have to understand that when technology becomes a nuisance, when technology harms us, we have to be very, very careful, and we cannot allow that to happen.
Very, very, very rightly said. And so, what are your views on usage of this social media? How do you think one can make most of it in the state of digital healthcare post-COVID?
See, social media is a double-edged sword, Kalpana ji. There is no doubt in my mind. Many years back, and now also I keep reading, many teenagers, once they are trolled on a social media platform, when someone talks badly to them on social media platforms, they get deeply hurt. It has emotional sort of a traumatic experience for youngsters, for many people, And similarly, also, we have heard about social, sort of stalking on the net. And so it has got its own drawbacks, and social media also plays sometimes a very negative role. But having said that, it's a technology available to us, and I said it in the beginning also. I mean, just before this question, it is, human beings have been given the minds to say what is right, what is wrong. If you are able to sift through that, if you are able to use technology where it is beneficial and keep it away where it is not beneficial, then it is very useful. And to answer your question about digital healthcare, see, let us say you have a watch, whether it is Goki or Apple Watch or Samsung or any watch, and it gives you a heart rate or a heart ECG. Now you cannot just think that, okay, I've seen my heart rate, it is a little fast, but I'm going to sit here, nothing, it's all right, or I'll just take a traditional pill or something like that. No, that technology has given you a sign, that technology has given you an input. You have to use it carefully. You have to talk to your doctor, you have to ring him up, you have to tell him, say, this is what I'm feeling, this is my ECG. Because these are not professional ECGs. I'm just giving a small example, and he will tell you, depending on the signs, he'll say, no, you have to come to the hospital, or I want to see this, I want to take some more other things also. So if you're going to look at technology in isolation and not use it properly, it can certainly be of harm, and so but as I said, it is on us to use the technology in a proper way.
Absolutely, very well said, sir. And I think you should not even miss even the slightest sign what your technology is showing it in terms of Apple Watch or Samsung Watch, whatever you're using it. कुछ बता रहा है तो you need to. It's an alarming thing.
Absolutely, exactly.
And you also said that it's okay you have to follow your allopathy or doctors what they are saying, but it is also okay simultaneously to follow the Ayurveda treatment or the naturopathy and all, but don't leave the main thing.
100% right. And as I said, our traditional treatments, our traditional ways of doing things, just example, I'm talking about yoga. The whole world does yoga today. It's not. But if you think a yoga is going to cure, once you, let us say you have a bad disease, you have a tumor in your brain, or you have a blood disorder, yoga is not going to cure it. Neither is drinking kada going to cure it. So our Ayurvedic means, our traditional means of exercising, our traditional ways of meditating are certainly good, and they are up to a point where you are not suffering from such a disease, God forbid, in which these practices will not have any effect, and they in fact can be detrimental. Let us say a person who's suffering from a disease which requires a surgery. Now, you keep on drinking kada, putting ilaichi and dalchini and everything, but you will have to go to the doctor. So, it is very good when you're building immunity. If you follow good practices, you won't fall sick. That is true. I mean, our traditional practices are that. But God forbid you have a disease, you must go and talk to your doctor, because allopathy and any such thing which is backed by a scientific data, a research has been done, a scientific data backs it up. I think you must not ignore that at all.
Very well said, sir. And a very last question: tell us about your journey from commander to the healthcare. How did it happen? 30 years of your
See, I'll tell you, I joined a very, very great institution, Bombay ke paas mein hai, called National Defense Academy, Khadakwasla, Pune. And that was, way back in 1987. And the motto of that institution is service before self, Seva Parmo Dharma. That was the motto of that. And it was drilled inside our heads, 3 years we trained. It was very, very tough training. As you're aware, NDA training was the toughest that day. And it was drilled inside the head that if you want to really go into serving your nation, if you want to go into Indian Army, Navy or Air Force, I mean, you have to, as a leader, as an officer, have to keep service before yourself. That means, they taught us your country, your unit, your people that you command come first before you, always and every time. And your own comfort comes last. So, having served in the Navy after NDA training, and I went and joined the Indian Navy, have served in the ships, traveled around the world. So this thing was ingrained deep inside me that my people come first, always and every time. So when I transitioned into healthcare, and if you really ask me truthfully, coming after the Hippocratic oath where the patient comes first, so it was something similar, and today you are seeing the healthcare workers, I'm talking about the doctors, the nurses, the paramedical staff, the housekeeping staff, the security staff, the administrative staff who are in the hospital are keeping their own security and safety last. The COVID is very infectious disease, it does not have any cure. But a doctor is going inside the COVID ward, wearing the PPE, garmi ho, kaise bhi ho, and treating a COVID patient. So they are keeping their own self, last May, first they are looking at the patient. So they are also, it's a service before self. So it was a natural sort of a progression from armed forces into healthcare. And touch wood, going has been good. I've been able to help a lot of people. And, many people congratulate me or tell me some good things, that you're today serving. And Narayan Health is one of the most trusted, transparent and ethical healthcare groups, in the world over. It is considered Dr. Devi Shetty is an icon today. You know about him. So when they congratulate me, I tell them, no, it's the other way around. I think I'm blessed by God that I've got this, this sort of a ability or this chance to continue serving people in many ways. And so I am blessed, Kalpana ji. I don't consider anything at all.
Yes, sir. मैंने भी आपको start होने से पहले यही बात कही थी. I mean, you're truly highly blessed by God कि God have chosen you, because not everybody is the chosen one. You have served our nation और अभी भी आप अपने nation को ही serve कर रहे हो in a very beautiful way. I know people are connecting to you, and whoever comes to you never goes without seeking that kind of help. And thank you so much for being so amazing. I salute you, sir. I'm also a huge fan of yours.
Thank you very much, and keep safe, and God bless you. And this is an amazing thing you're doing, passing the message to our people, and may everyone remain healthy and hearty, and may everyone remain safe. That's what I pray to God.
I still have few quick rapid fire for you. So I will take another 15 minutes of you, and thank you so much for your wonderful words and insightful thoughts. So quick rapid fire, who inspires you the most?
My mother.
Achha. And the greatest risk you have ever taken?
I left service, when I was doing extremely well, and with nothing in my hand, and I jumped into the corporate world, not going wherever I was going. And my children were still at school that time; they were not settled, and I think that was the greatest risk I took.
And what is the most memorable moment of your life?
There was a cerebral palsy student who was doing quite well, but not one of the many. There have been many memorable moments, but I'm just talking about one of them. And he was not getting a job, and but he was brilliant, and I got him into healthcare. Nobody would recruit him, and today he's a part of our team, and when you see the look on his face, it was wonderful. And one more moment, very memorable moment, was when I held my daughter in my hand for the first time when she was born. Yes. I think that was also very memorable.
सारे parents के लिए वो बहुत ही memorable होता है, एकदम सही था sir. And if you could change one thing about yourself, what would it be?
Nothing I would like to change, but I think one thing that I would like to do, not change is, I've given a chance. People have always told me that my voice is very good, so I've always thought that, maybe I should go and become a radio RJ or something, or maybe go and sing. That's one thing that I, always wanted to do, and maybe someday, given a chance, I might do so.
Yeah, why not? Cross fingers. और मैं भी आपको सुनना चाहूंगी वहाँ पे. Well, and any favorite hobby?
Yeah, I would love to go into to become a farmer. I mean, given a chance many years back, I remember it was I think in my 12th standard, I ran away to my house in Kashmir. My mother was so worried when I said that I'm not going to study more. I'm going to open a walnut farm. So I think I love farming. I would love to go into the fields and actually take a thing and do it myself. Something that is very close to my heart.
Wow. And place where you love being the most?
I didn't get your point.
Place where you love being the most?
Place where I love being the most? Yeah. I think my village in Kashmir, and it was many years back that we moved out from there because we migrated because of the reasons, we all know. But that is one of the most beautiful places in the world. The people of my village are the most loving people I've ever met. And that is somewhere I would love to go again and again and again.
Oh, I didn't know you're from Kashmir. Oh, this Jannat hai. And in fact, even we are opening a SHG group at Jammu and Kashmir.
Oh, lovely. That'd be great. We can get in touch. We can do a lot of things for our people there in Kashmir.
Yes. Definitely. I'm already in touch with the administrative over there. We have already have teams working, with us, and we have done with the whole project report and everything.
I hope we have a hospital in Katra. Narayana has its own hospital in Katra, and so I think we should get in touch, because that's one of the the most respected institutes in entire Jammu Kashmir state, and right now fighting COVID. It's a very beautiful and a very well equipped and a top of the line hospital near Jammu, near Katra. Vaishno Devi ke paas mein hi hai.
Oh, wonderful. Yes, I'll definitely get in touch with you and with my team, in fact. So
please do that.
Thank you so much, sir. And the very last question: if you were to be the Prime Minister for a day, what is the first thing you would do?
I would.
कुछ तो change होगा. Something you would want to do.
A Prime Minister for a day. I don't know what, but I think if given a chance, and if I would to become a Prime Minister for the day, I would, for that one day, I would tell every Indian, that for just one day, stop all differences, stop talking bad about each other, stop cursing each other, stop using politics, religion, language as this one. For just one day, think about the common man, and for that just one day, do something for every Indian and forget about every other distance. I would love that for that one day, there is no bad news talking about each other, there is no trolls, there is no social media accusing each one of us. And for that just one day, this country just thinks about our country, our common man on the street, and does something for them. For that one day.
Noble thought, sir. Such a noble thought. आप practice भी बहुत noble काम कर रहे हो, और thought आपकी यहाँ पे भी इतनी noble है. I am truly touched, sir. I have never known you so personally, but after knowing you, as I told you, I have become your fan now. A word of wisdom or an advice to our audience?
Yeah, see, in these times, the wisest of people have, they have come nowhere, and the wisest of people are giving. I can only say one thing, that, it is better to buy a, 100 rupees mask and wear it rather than getting into an ICU with the oxygen levels down. That is number one. And also in it, what it means is that, there is something going on right now in the ecosystem. We are going to face this stressful times. Reduce the stress by taking some precautions. And also, I think many people who are, a little bit wiser, I think they have a great amount of responsibility towards children. They have great amount of responsibility towards their elder parents, because right now, everyone is in stress, and if you find someone who is looking little dicey psychologically, who is talking little, lost, or you see somebody depressed, I think these times you have great responsibility to talk to them as much as you can. Try to, motivate them, because these times, some of them have lost their jobs. The children are stressed because schools are not happening. Elderly are stressed that because of their age, they might, something might happen. I think for all of us who are thankfully, touch wood, in that state, I think we must, hold hands of each other. This is a time when, we require people to hold hands and talk to each other nicely.
Absolutely, sir. Absolutely. Very well said. Sir, do you have any message for our organization, Social Tables?
Yeah, Kalpana, so I think you are doing a great job, and I don't know how you found me. I have no idea at all. So but I think what I could gather in this interview today, and what I could gather from interaction with you, that I think you guys are doing a very, very good, straightforward, clean work. And very few organizations I find who actually do this kind of work. There are always layers between layers. There are some hidden motives. So I have no advice for you but to say that please keep up the good work. Bring out people who are doing something good selflessly. I mean, put them in the in the limelight. Tell people about them, and use this to motivate, to tell our general population in general to become better citizens. I think if all of us are going to do that, India is going to. It's a great country today, but if everyone becomes the way the message that you put across, I think it will be wonderful. So I have no word but to thank you.
Oh, thank you so much for your wonderful words, sir, and your blessings. But I would just want to let you know, I mean, I started this during COVID, after this COVID happened, and I thought it was very important to have dialogue and to understand not only from the MDs, CEOs, or politicians or something, but even from the most vulnerable community where they are not even given such kind of platform. And now government of India also have tied up with us. We are doing on Abdul Kalamji's birthdays on former president on October 15th, and we are doing Abdul Kalam Innovation Series, all Padma Shri, Padma Bhushan.
Don't forget to wish me on 17th October. That's my birthday.
I will.
I thought I will let you know.
Happy birthday, or I will definitely wish you on your birthday. Thank you so much for letting me know. So this is something जो आपने कहा कि you get those people and talk. So we are also getting people who are innovators, who have done amazing work in terms of technology, who are doing. We want to spread this word globally as well, because India में इतना सारा innovation है, technology है, आप आइए use कीजिए and let's grow together. So this is something which we'll launch it on October 15th, of course, with Government of India.
God bless you and God bless your work.
So much, sir. Thank you so much. Well, that's it for today. Thank you so much. Let me take an opportunity to thank you. It's a great honor and privilege to propose vote of thanks to you, Mr. Commander Navneet Bali, who, despite of his busy schedule, has found this time to grace this special interaction. We are extremely grateful to you for sharing your words of encouragement and giving us valuable inputs. Your eminent presence has indeed made this interaction a memorable one, and we unite to thank you from the bottom of our heart for your kindness, interest, and support. We wish you all the very best in your endeavors. Stay safe.
Thank you, Jai Hind.
Jai Hind.